I've turned my hearing aid all the way up.
Ready?
So,
Good evening, everyone. Welcome to our Lifting the Lid on Cancer and Fatigue. We have an amazing panel for you this evening, people who have had lived experience of cancer themselves and experts in the field. We know that cancer causes so many multifaceted problems, and one of the most debilitating ones that people say is living with cancer-related fatigue. It's the one thing that causes the most depletion in quality of life, and that's why we wanted to lift the lid on this evening. It's described by some people as jet lag, bad hangover, and flu all rolled into one, and some. And it's the number one thing that people living with really struggle with. 9 out of 10 people with cancer get cancer-related fatigue. We know that more and more people are being diagnosed with cancer, so we know just how important it is to improve people's quality of life. So that's why we have this amazing panel this evening to be speaking to you about their own experiences. So I'm going to introduce the panel. We've got Ruth, who was diagnosed with sarcoma herself at 21 and has been living with, is 8 years post? No.
6.
6 years post
years
finishing
post.
Treatment. And we have Alistair, who is a dietitian himself and was diagnosed with testicular cancer at 29. We have Annice Mukherjee, who had breast cancer 10 years ago. She's a UK medical consultant and hormone specialist with almost 3 decades of experience working in hospital medicine. Her special interests include women's health, hormone health, consequences of cancer treatment, menopause, puberty, thyroid disease, calcium and bone disorders, and chronic fatigue management. Annice has extensive experience in fatigue investigation and management, has led a national chronic fatigue service at Salford Royal NHS Trust for 12 years. We also have Jo McNamara, is a therapeutic radiographer by background with over 20 years worth of experience working in oncology. She's in education, lecturing on oncology across the health and social care. In 2020, Jo was the National Therapeutic Radiography Clinical Fellow at Macmillan and worked on the Prosper project, educating healthcare professionals about the role of prehab, rehabilitation, and personalised care in oncology. This passion has continued forwards into research, publications, and creating an MSc module for oncology specialists. She is the radiotherapy chair for the UK Acute Oncology Society, the chair for the Promotion and Outreach Special Interest Group, a radiotherapy UK champion, and a Yorkshire healthcare professional for 5K Your Way. And she runs the fantastic oncology podcast called Rad Chat with her colleague Naaman Jolka Anderson, which I had the pleasure of appearing on. Welcome, everybody. Thank you for joining us this evening. So we're going to kick off with having a chat with you, Ruth. So as I said, fatigue is described as jet lag, a really bad hangover, and flu all rolled into one. Would you say that is about right, or do you think that's even an underestimate of what it's like?
I think that's about right. I think it's as much a mental disability as a physical disability. So you've obviously got the physical disabling side effects of it, but I think it's also this kind of brain fog, you can't think clearly, slurring your words, like you've had a bit too much to drink, and all of that kind of thing. So it definitely feels like a physical and a mental side effect from the cancer. So
you were diagnosed 6 years ago with sarcoma.
Yeah, so I think I was diagnosed 7 years ago, but I finished treatment 6 years ago.
Okay, you finished treatment 6 years ago.
Yep.
And you were diagnosed, when you were diagnosed with sarcoma, do you think you were prepared by your oncology team for how debilitating your fatigue would be?
No, I think they give you the list of side effects, and obviously there are so many other ones that you're kind of focused on those. So they talk about infertility, they talk about risks of secondary cancers, and then they present fatigue, which is presented as a little bit of tiredness. So actually, that kind of you don't even think about that. That's at the very back of your mind.
So you're just putting your head down, getting through treatment, and then you emerge.
Yes. Yeah.
And do you feel, when you were post-treatment and you started to want to put your life back together again, tell me what the impact of having fatigue had on you.
So I think I really first noticed it when I think it was towards the end of my treatment, and usually when I was quite tired, that meant I needed a blood transfusion. So I went, had my bloods checked, and they were all fine. And I was like, what's going on? Like, what's wrong? And they said, oh, it's probably just fatigue. And then I think about 3 months after treatment, I was the most tired I had ever been. And I thought, hang on, this is the moment I'm supposed to be, like, this is the moment I've been waiting for so long. And I can't do anything because I'm so tired all the time. And I think then I had been looking forward to starting a job, which I had already deferred because of my diagnosis, but I just thought, I can't start it at the moment. I need to find something that is manageable whilst I'm trying to work out this new side effect and work out what I can actually do, along with having, afternoon naps and getting up later and all of that kind of thing.
And how did it impact your daily life? So wake up in the morning feeling refreshed?
Not really. I think I'd just wake up and I'd already be tired. I think it was as soon as I finished treatment, it had a large impact on me. And when you're just going to and from the hospital, you don't notice it as much because there's only the hospital to go to. But as soon as you start doing other things, you go and do one event and then that's it for the rest of the day.
Wiped out. Sorry, wiped out.
Yeah.
And when you went back to work, do you think that you had prepared for the fact that you weren't coping with fatigue already, and then you throw work into the mix?
Yeah.
Tell me a little bit about that.
So I was meant to be starting a job like as a trainee teacher, but I had to defer that because I was nowhere near ready, and I actually started a kind of teaching assistant job, but I was going in later to that. I was finishing earlier. I was working reduced hours, and that would still take it all out of me. And then I thought, hang on, like, I want to have a social life as well. I want to see my friends. And I think because I looked physically better, it was quite hard for people to understand.
Yeah.
Yeah.
Very lonely as well, because you just want to get back to the life that you used to have, and then fatigue robs you of that, and you're having to work out what's
and I think
the way to manage it.
It's not very common in our age group at all. So I was this 22-year-old who had to be like, oh, I have to go to bed early now, or something like that. Because if I didn't go to bed at the right time, then that was the whole next day gone. And you're just meeting up with friends. And it does feel like you're isolated.
And Alistair, what about you? Does that resonate with
Completely,
you?
yeah. I think you hit the nail on the head when you said the mind fog thing, or chemo brain, they call it on the wards. I remember there was a chap on the wards that I was on relatively recently, and they would always blame the way they felt in terms of their fatigue on chemo brain, and it's become that almost a hashtag. In my experience, with my cancer, I had 2 brain surgeries, and in terms of recovering from those, the surgeon would say to you in recovery, by the way, the time that it can take to recover from this tiredness, this somnolence, can be 6 months to up to a year in some cases. So technically, I'm still recovering from the brain surgery I had in November last year, and it's that pressure that you put on yourself, thinking, okay, it's been a few months now. I can try and do a little bit more. I can maybe think about not being this isolated patient that doesn't see anyone, and get out for a walk more. And we did actually, my partner and I, we got a dog halfway through my diagnosis, and that's been a godsend.
What type of dog did you get?
He is a miniature Dachshund.
Oh,
I
I love a Dachshund.
He is the loudest thing in the world, and he has such an attitude, but...
What's his name?
His name's Pluto.
Pluto, I like this. This is great.
Yeah.
I'm going to turn to you now, Annice. Thank you very much, Alistair.
No worries.
What is the medical definition of fatigue?
There isn't really a medical definition, to be honest. It's not a medical term, it's a description of a symptom. and it's an umbrella term. It can be used in many, many different situations. And in fact, a little bit of fatigue is something that everyone on the planet will experience at certain times. And it's when it starts to impact on your daily life that it's considered more of a medical sort of paradigm. And, you know, there are many, many different causes. And so obviously here today, we're talking about cancer fatigue. And it's really, really interesting listening to those stories just now, because it's different for everybody. I went through a cancer diagnosis and I didn't have chemo. And you're talking about chemo brain, and it's going through chemotherapy is like a marathon. As a junior doctor, I had a few years working on cancer wards where I would be giving chemotherapy even in the early days, and you know, looking after patients on chemotherapy. And it's depleting on your body, and that's the whole point. It's supposed to be toxic because it's killing all the cancer cells, but it's also utterly exhausting and relentless for several months. And, you know, after chemo, when you're absolutely exhausted, as has been described, it's a little bit like a burnout, because you've been on a marathon, your body's been trying to run on adrenaline, and it's absolutely exhausting. So I'm not sure it's, what I was going to say was, you know, in cancer, not everybody experiences fatigue, but there are so many different types of cancer. There's different types of treatment, there's different stages, there's different times from treatment that we're looking at, you know, whether people have fatigue. And it's a really sort of very, very broad, you know, infinite picture really of what symptoms people can have. So we use fatigue to describe a symptom, but it's not really one thing.
So we've heard a little bit of symptoms. We've heard about brain fog. We've heard about not waking up refreshed. Heard about not being able to be able, you know, needing naps in the day. But there are so many other symptoms, signs of having fatigue. What other ways can you tell that your body is coping with fatigue?
Or dealing with fatigue? Well, you know, problems with sleep often come with fatigue, and your adrenal glands are kind of trying to cope with life and fight or flight type things, you know, everyday life. And when you're going through chemo again, you're kind of you're in a chronic stress situation. So that can disturb your body clocks, that can cause you to go to bed wired. It can often cause you to wake up unrefreshed, which is something that a lot of people describe. And you can get sort of episodes during the day where you kind of crash. And those are quite scary symptoms. They can be associated with dizziness or other non-specific symptoms. And so it can be quite, you know, quite disorientating and frightening. And again, you know, somebody who's going through a cancer diagnosis might think, is this the cancer? Is it something else? Is it a sugar crash because, you know, I haven't been eating properly, or, you know, I've lost weight and I'm not getting enough calories in? It's just so multi-layered. And then if you add in, if somebody has other medical problems, if you know that they had fatigue before because they had insomnia or other problems, if you add health anxiety, which is almost inevitable with a cancer diagnosis and going through cancer treatment, it's just infinite. It's multi-layered. So actually getting to the bottom of how you manage it is to some extent different for everybody.
Yeah.
But you have to work out what the driving causes are in order to find solutions, which there are solutions.
Which we'll get to in a minute. Thank you very much, Annice. Joe, tell me a little bit about so you're an expert in radiotherapy, you're I'm going to get this wrong. A therapeutic radiographer, I should know that.
That'll be the one.
There we go. Tell me, why do you get fatigue from radiotherapy?
Okay, so how I always describe it is essentially we have the biological aspects of the radiotherapy. We also have the psychological, as Annice has commented on, and we also have the social. So coming to radiotherapy every day isn't just a case of coming to the hospital. You're having to find parking. You're having to think about, have I got the change to pay the parking meters? I'm having to think, right, how long do I need to put on the meter? So all of that is anxiety inducing, which sounds minimal, doesn't it? But actually layered on top, exactly as Annice has said, is really stressful. You then have a wait in the radiotherapy department because unfortunately a patient's been poorly. So we're behind, so you have to wait for an hour. So you're sitting there for a full hour. All of these things contributes to potentially feeling fatigue whilst you're on treatment. On top of that, you have obviously the psychological demands. During radiotherapy, typically we find patients have had other adjuvant treatments or concurrent treatments. And actually it means that they could have been through a cancer pathway extremely quickly. And as a result of that, it's only when they come for radiotherapy and they're having to sit and wait for treatment that they're really starting to reflect on the journey that they've been through. And that in itself can be psychologically demanding and stress inducing. So from that perspective, it can definitely contribute to fatigue. And then you obviously have the biological aspects of fatigue. So when you are coming for radiotherapy or chemotherapy, you will find that we're damaging the cells. So at that cellular level, you have so much going on internally. I won't bore everyone with the radiobiology of everything, because you won't invite me on again. But
go on, Jo, give us a little bit.
So within our cells, we have lots of different organelles. So within those organelles, essentially, you have enzymes, proteins, you have interleukin cells. All of these things are essentially affected by either the radiation or the chemotherapy. When that happens, your body is having to repair your normal tissues, but also excrete any cells that have undergone apoptosis, which essentially is cellular death. So, we are aiming to kill those cancer cells, but we, as our bodies, need to remove them. And that takes energy. And that's where some of the biological responses come from, actually inducing fatigue. So it is very multifaceted, but essentially that's why we are exhausted when we're going through treatment, because our body is being assaulted by either toxic chemicals with chemotherapy or potentially radiotherapy. And then you could potentially also add in hormone therapy and immunotherapy as well.
And surgery as well.
And yeah, absolutely. Yeah.
If you had radiotherapy to your pelvis or to your brain, would you have different types of fatigue? Would you have worse fatigue, or is it even more complicated than that?
It's a little bit more complicated, just because obviously if we are treating the brain, then potentially we are treating structures within the brain that are responsible for sleep. So that could actually be very different too. If I was treating a patient with the pelvis and they said, I'm really suffering from fatigue, the first question I ask is, how many times are you getting up in the night for a wee? Because actually sometimes it's not because of the actual treatment, it's because of the side effects from the treatment that are then impacting on that patient and their ability to have a good quality night's sleep. That could be the same said for areas of the body that might have a skin reaction as a result of radiotherapy. It can be really uncomfortable, it can be really sore. So again, that can contribute to disturbed sleep.
So as we can keep hearing, it's so multifaceted. And also, what about if you had two patients, Annice and Jo? If you had two patients, they're having exactly the same chemo, exactly the same radiotherapy. Should we just start with one? Chemotherapy, same diagnosis, same regime, same everything. Let's just say same age, same ethnicity. Would they have the same amount of fatigue?
No.
Well, that was easy. Is there any research that suggests that different communities, different ethnicities, different age groups get worse fatigue? Jo?
From my perspective, I haven't seen any research that suggests that a particular demographic of patient is more susceptible to fatigue. You can definitely see through some of the research that certain cancer patients with the area that we're treating can potentially suffer more fatigue. But as I said, it's because if we are treating the brain, you're treating structures that potentially affect circadian rhythms. So from that perspective, then absolutely you could have patients that suffer more with fatigue. But absolutely, I also believe that perception comes into it as well. Yep. So yes, fatigue is always going to happen to some extent, but actually you might have a 60-year-old that's had a very sedentary life, and from their perspective, they have a bit of fatigue, but because they're not used to being active, they maybe don't notice it so much. Whereas obviously for myself, when I had cancer, I was really active and it was like hitting a brick wall. I was literally like, why can't I get up? And a lot of people thought I was depressed, and it wasn't because I was depressed. I was absolutely exhausted. So I think it is so different.
But you've hit a nail on the head there. It's a bit of both, isn't it? It could be you are quite low from going through cancer treatment, coping with having to get up and to go to the loo in the night, the hormones being affected, circadian rhythm being affected, cell death, all of it. So I think it's underplayed of how depleting and how much psychological impact the mental health element of, I'm going to come to you guys in a minute, impacts your fatigue.
Yeah, and I was just going to add to what Jo said, because, speaking about two people who are the same age going through the same treatment, they won't have the same symptoms. So we know that it's depleting. We know that all of these things can happen, but some people can hit a wall and some people might not. And that might link with how anxious that person is, how much that the treatment is impacting their sleep. It might be how much psychological support they've got around them, their support network. It might be historic events that have happened to them that have made them more anxious about their current diagnosis. It could be to do with their integrated health, how fit and healthy they were before the treatment, even if they're the same age. So, how anemic they are. You can have two people going through chemotherapy at the same time. One might be anemic and one might not be, because their gut's working better and they're absorbing the micronutrients still, whereas somebody else might not be. So there's just so many different factors. So one thing no one should ever feel bad about is if they have better or worse symptoms than anyone else, because it's not the same playing field for everybody. So I think we all have to acknowledge that and, just go with what we have and work on that rather than comparing, really.
That's such a really good point, isn't it? It's so easy to compare yourself to someone else who's young, who's going through cancer. Why can't I do that? And then you've got comparison to your friends. Like, it's not fair. I want to just do what they're doing. Ruth, how did your friends respond to you coping with fatigue? Or did they even acknowledge it?
I think they were, because they had seen me go through treatment and they'd seen the impact of that, they were actually very good about it. But after I'd finished treatment, it was quite different, because I didn't look so physically ill. My hair was growing back, all of that kind of thing. So they kind of assume you're back to normal. And then I was still there, like exhausted by something, or even little things that they don't even take into account when meeting up or arranging something, and you're like, I actually can't stand for that long time. I think it was even just going to like friends' houses and parties, and those things where you're standing up for such a long period of time, and I'd be like looking for a seat, and I'd be like, well, I don't want to just sit down on a chair on my own, and I'd try and drag someone over to sit down with me, because I just couldn't stand up any longer. But I still wanted to be there with my friends. But it did feel like I felt, elderly.
Yeah.
I didn't feel like I was in my 20s.
I mean, that's so difficult, isn't it? So difficult. And friends didn't get it? Friends didn't realize?
I think you have to be very clear. But I think for me, even, because I was trying so hard to be normal, I was like, yeah, of course I'll come to this. Of course I'll do that. It's not going to be a problem at all. It's only when you get there you realise, you're pushing yourself too hard.
We'll talk about that in a minute, won't we? Alistair, what about you? How did your friends respond with?
I was going to add a tiny thing to Jo's spiel, and it's the apoptosis and the inflammation. I think that inflammation that is almost driving your metabolism up a little bit. It's what's eating away at your energy stores, and I wanted to just add that in, because my experience was actually quite different.
Okay.
I don't know if this is because of the insight I had beforehand, or because I was a very regular gym goer and a dietitian following very, up-to-date nutritional advice. I tended to get through the treatments quite well. And I don't know if this is because of what I was eating, because of my mindset.
Bit of everything, right?
Yeah, I mean, when I was diagnosed, I was I decided I was going to take it on as a challenge rather than take it on as an ailment, like as a negative thing. And I guess I came from a very different perspective. I'm still technically going through treatment. I haven't been given the all clear or go ahead yet, but I think I'm there. But it's taken 3 years, and through that, I've gone on a roller coaster of having energy and then not having energy. And as you said, we're going to talk about pushing ourselves before maybe it's time, which was one of my biggest problems, I think. I was constantly having not an argument, but a discussion with my doctors. When can I go back to the gym? Alistair, it's COVID. Like, you probably won't be going back to the gym through the whole of COVID. And understanding that and thinking, okay, I'm going to have to walk. I'm not allowed to cycle because my doctors have said that's not safe. So I'm just going to have to do a lot of walking. And actually, I've actually decided I actually love walking now.
Great, isn't it?
Yeah. Before I was just like, walking not for me. I'd rather be on a bike or lifting weights. And it's turned that a little bit upside down.
Well, we're definitely going to talk, aren't we, in a minute, Joe, about prehab and rehab. But can we just go back to holistic needs assessments, Joe and Annice, in terms of, did you two get a holistic needs assessment, Ruth? Naz, did you get one?
What do you mean by holistic needs assessment?
See, the other thing is a lot of people don't even know they're called this, which is questions asked you about how you're doing with sleep, fatigue, sex, relationships, mental health. Joe, more? Walking, mobility. Have I got any? How the drugs are affecting you? So you go through it with a clinical nurse specialist. Diet. So, oh my goodness, diet. And you get it at the beginning of treatment. You should have it along the way, and ideally you'd have it at the end of treatment. Yeah. And you'd also get a treatment summary, and you'd get a care plan. That's what you're all meant to get. Ruth, did you get that?
My treatment was amazing. I love my oncology team, but
No.
I'm not.
You don't know what I'm
I don't
talking
even
about.
know what you're talking about.
Alistair?
I'm the same as you. Loved my team at the Royal Marsden, and I do feel that maybe because I'm coming from a medical background, I did have that conversation with them, and I was having what we call, a multidisciplinary team, MDT, every time I would have a chat with my doctors. And I think that allowed me to talk to them a little bit more about if I had concerns about my eating, my weight, or all those other things that fall into a needs assessment. But I have a really good bubble with my parents, my partner, girlfriend, and obviously Pluto the dog, who had a lot of input to my care, and I think that it did get covered, but I think that's obviously, as I said, because I think I brought it to the conversation because I know with my patients I would do a needs assessment, particularly with things like weight, diet, and their mental health and things.
Annice, you talked about how your own diagnosis, because you're a doctor, you were able to use all that knowledge to help you cope with your fatigue as well.
Yeah, and I don't think I had a holistic needs assessment, but then I didn't have chemotherapy. I had hormone therapy rather than chemotherapy.
But you still need a holistic needs assessment, don't you?
Right, but I didn't really get any of that. But I didn't need it because I understood a lot about what I was going through, and I had a big support network, and I did know what to do. So I think what you're pointing out is that it's quite patchy, and I think since COVID, probably again, there's a real postcode lottery, or it's a bit of randomness as to how thorough those types of approaches are. But it is really important when you talk about 9 out of 10 patients receiving treatment for cancer having symptoms that are pernicious of fatigue, and actually understanding the different factors that are eating into that for any individual are really important and can be obtained from that type of assessment. So I think it does need to be rolled out more efficiently and reliably.
Jo, can we turn to you? What are patients meant to get when they are going through cancer when it comes to fatigue?
So technically, every interaction that you have with a healthcare professional, they should review your holistic needs assessment. Now, it may not necessarily be a clipboard with the sheet there and they're kind of like writing everything down. It may be very much, as you've described, having an MDT meeting, discussing things, but then after that, as part of kind of the write-up of that interaction with the patient, they would then fill out the holistic needs assessment. Essentially, it's a way for us to be able to track patients and their holistic needs as they go through the treatment pathway and beyond. And I think it's really important for us to be able to have that holistic needs assessment to deliver personalised care. How am I supposed to know what's important to a patient if I haven't asked the question? And I think that's really important. We absolutely have generic things that we need to do to ensure that our patients receive quality treatment and hopefully we cure their cancer. But actually, it's also about making sure what's important for that patient and their ongoing quality of life. And I think some of the discussions that I have with patients is that they don't realise how much fatigue will impact on their quality of life. And if you know that you're going to have a specific treatment where that is going to be the consequence and you're not prepared for it physically, mentally, socially, then it can actually hit you harder and create even more of an issue. And I think that's where the HNA comes in even more. Sometimes they're not always called holistic needs assessments, which again is not a good thing because it means that there's disparity in maybe some of the paperwork that healthcare professionals are using. And sometimes it varies across different disciplines, which doesn't necessarily help when a cancer patient and potentially a cancer patient with other healthcare needs as well is transitioning through that pathway.
Thank you so much. Jo, can I just ask you, if someone who is listening this evening is really struggling with the impact that her fatigue or his fatigue or their fatigue is having on their life, what can they do if they're post-treatment? What would be the right avenue? And if they're going through treatment, what would be the right avenue?
Okay, so if you're going through treatment, you will have an oncology team. So to be honest, I would suggest reaching out to the person that you built the best rapport with. So some people will say that might be a clinical nurse specialist, it might be the therapeutic radiographers, it may be your GP. From my personal perspective, I think it's important having that rapport to be able to kind of open up about maybe some of the things that are really affecting patients. Post-treatment, now it depends on where you live in the country, and it actually hurts me to say that because that should not be the case. It shouldn't matter where you live. But actually, for some patients, they have access to late effects clinics. So that would be the first thing to do, is actually do a Google search of NHS late effects clinics in your area. If there is one of those, ring them up, email them, tweet them. There's, social media for lots of different care pathways now. Get in touch with someone. If there isn't one around, then obviously you can go back to your oncologist. They are always able to be contacted. But this is where sometimes there's disparity. Do you go to your GP who doesn't feel confident in managing some of the cancer side effects and will then refer you straight back to your oncologist? Or will the oncologist say, I'm not sure that's a consequence of cancer treatment, I think you need to go back to your GP for a diagnostic pathway. Okay. So it can be conflicting for patients, and I feel your pain.
I think that's a really important point, because it's not always cancer causing the fatigue. And Annice, it's really important to think about things like low iron, vitamin D, B12. I'm just looking at what else do you need to be thinking about?
I mean, and I think the point was raised before, is that fatigue is very invisible. So you can go out with your friends and they can't see how impacting those symptoms are on you. And equally, you go to your consultation with your doctor or the specialist, And if they don't ask you about fatigue, then they can ask you a whole load of questions about the cancer, and they won't really know about a major symptom. So that's really, really important, because you're quite right. And the late effects clinics were originally set up to look at sort of all the different consequences of cancer treatment that can be caused by chemotherapy, radiotherapy. It's different parts of the body, and there's lots of hormone consequences, which I've had lots of involvement in. But as Joe mentioned, if you have radiotherapy to the pelvis, it can affect your bowels, it can affect which can affect, nutrient absorption, things like that. It can affect your bladder, it can be up all night. There's so many different causes. So if fatigue might be the symptom, but the main symptom that you notice, but there may be a number of different causes that could be addressed. And, there can be things like lack of sleep, poor nutrition, even lack of movement, physical weakness. But there can be, as you say, anemia. You could be iron deficient, you could have a thyroid problem, you could have, all sorts of different other problems that can be related to your previous treatment. So I think it's kind of a Cinderella symptom, fatigue, and it's kind of dismissed and ignored a lot. And it's invisible unless you admit to it. No one knows. So it's really important to raise it, because I wouldn't say it's like Pandora's box, but there are good medical algorithms that we can work through to exclude physical causes, sort of medical causes. And then if we can exclude those, then we can home in on, is it sleep? Is it activity? Are you having boom bust activity cycles and doing too much and then crashing? And, there's lots of different aspects that can contribute, but you can home in on those relatively quickly if you've got somebody who can exclude those other causes.
I keep thinking about your house of menopause. It's like that, isn't it? When it comes to fatigue, it's the house of fatigue. I'm going to plug Annice's fantastic book about menopause, because she talks about house of menopause, and when it comes to looking at all the different ways that you can insulate a house, and it's the same with fatigue, all the different approaches you could have to addressing your fatigue. Is that fair to say, Annice?
And actually, that is a completely authentic sort of thing that I came up with from my fatigue clinics, So in my fatigue clinics, that's what I noticed, that patients would come to me, often having had a cancer diagnosis, and often having been sent to loads of different specialists with isolated symptoms, which were not fatigue. And then the penny would drop that actually this fatigue is impacting on different systems of the body. And I would see that looking at one single thing in isolation wouldn't work for fatigue, but if you address all the different potential contributors, whether it be iron deficiency, nutrition, whether it be thyroid problems, whether it be activity with sleep or other factors, if you address all of them, that's when you make progress. If you try and focus on one single thing and just put all your eggs in one basket, as it were, it doesn't work. It just doesn't work for fatigue, particularly if tests are normal. I mean, if you've got severe anemia and you have a transfusion of iron or blood, then that's different. But a lot of the time, tests are relatively okay, and you're left thinking, I don't really know what's going on. And so that's when we need to look at everything holistically.
Well, let's talk about, because at Trexdot, we're all about talking about solutions. Like, we know it's rubbish, it's awful going through cancer treatment and then being left with horrendous fatigue. So, Annice, going back to you, what are the strategies that people can use to address fatigue? Leave Joe to talk about rehab, prehab, but if we just talk about things like different strategies, should we take one symptom? Should we take sleep for one? And we'll come to you as well talking about that.
Well, what I would say in the first instance is your team, whether it be your GP or your cancer team, are important in that, because if you've got a thought, this is the cancer, this is the I'm only tired because it's the cancer, which can be an intrusive thought. It's very difficult to sort out your anxiety and your sleep if you're focused on the symptom being directly related to the cancer progressing or not being managed. So if you've had reassurance from your team, then you should focus on the symptoms. So for sleep is a really difficult thing to manage, because our sleep in the modern world is disrupted by many things, about our body clocks, because we've all got stress that's imbalanced. Everybody pretty much has. So that means that often it's difficult to get to sleep, or you wake up early in the morning and unrefreshed. Things like blue light on screens are really, really bad because they suppress melatonin, which is a sleep-inducing brain hormone. And the other problem with sleep is what you need to do to help with your sleep, to help with your fatigue, is often counterintuitive. And what I mean by that is your brain will say, I'm tired, I need to sleep, I need to have a nap during the day. Then you might fall asleep. You mean to only have 10 minutes, you have 2 hours. And that daytime sleep disrupts your nighttime sleep. And I've seen lots of people who say, I'm sleeping 15 hours a day and I'm still tired. And I say, you will never sleep enough, and then that will be enough sleep. Actually, too much sleep is as bad as too little sleep. And I see far more people with fatigue who are sleeping excessively than people who are not getting enough sleep. I do see some people who say, I'm getting 5 hours sleep, I don't know why I'm tired. And I go, well, that's not enough sleep. The sweet spot for sleep is about 6 to 8 hours. And if you're tired, trying to sleep for 10, 12 hours isn't going to get rid of your fatigue, because it's going to actually disrupt the quality of your sleep. So having a sleep routine, simple things that sound obvious but often get forgotten, are things like not having caffeinated drinks in the evening, because caffeine has a half-life of about 6 hours. So if you're having caffeine at 7 o'clock in the evening, even if it's a green tea that's got a little bit of caffeine in it, it can suppress, your onset of sleep. Getting rid of screen time or any stressful interactions late at night. Eating late, having a big meal is a metabolically very active activity for your body. So eating late and having a full tummy can disrupt your sleep at night. So there are lots of different things that we can do to improve sleep. But when we do that, it doesn't work overnight. So if you've had terrible sleep for ages, you have to apply those strategies. Know that you've sort of clamped them as almost like a prescriptive approach. I'm doing this every day. And don't expect to see an improvement in your sleep for quite a while. Sleeping tablets are a false economy because they make you sleep that night, but then you become dependent on them for sleep, so they're not good. And there are a few herbal treatments that people try. There's lots of herbal treatments that are popular. Often they're kind of based a bit on urban myths. So things like tryptophan, which is popular, the basis of that, there's kind of a scientific basis, but then it's twisted a bit, so it's hyped up. So tryptophan might well help. It's an amino acid, so if you've got a balanced diet, you should have enough anyway. But if you haven't got enough, tryptophan does improve release of serotonin, and that can have an impact on melatonin that can help your sleep. But generally speaking, people have enough. I mean, we've got a dietitian here who can talk about that.
I'm about to turn to you in a minute.
Yeah. And then, there's other supplements, and people ask about things like magnesium. There's very, very minimal, if any, research. It's all the urban myth, and there's no good research on magnesium and sleep, although it's used by virtually everyone who has sleep problems. And sometimes B vitamins can be helpful. But, none of those actually have any good scientific research basis. So what I say is, look, if you want to try something, if it works brilliantly, great. But you do get placebo effects from these things. So you might feel better for a few days or a few weeks, and then it stops working. And you think, well, it was working. But remember, placebo effect is quite powerful with supplements. So I would say if it doesn't work after a while, then it's probably not worth persevering.
Astra, are you gonna?
So Annice, you've talked about so many subjects that I can try and add on to, but I think
you can develop them. You can
yes, I'll try
yeah.
and add on some development in them. So, for example, I was just thinking I was the only one who woke up a few times a night to go to toilet, but that is one of the main things that affects my sleep at the moment. But if we're talking about, say, things, it's my biggest job when I'm talking to patients, when I'm talking to people about cancer, is getting them to avoid the misinformation. Sorry, I just need to do a big sniff.
That's right.
Sorry, because my medication, which is an anti-seizure medication, it makes me produce a lot of mucus. And and it can sometimes be a nightmare. But anyway, sorry. I wanted to talk about making things as simple and easy as possible. And the Trek Stock booklet goes into this quite a bit. Have to mention that.
Thank you so much for that plug. I didn't even pay him for that.
Absolutely fine. And because it does put a load of useful factors in there on making life easier. And that is food prep, asking for help, getting people to, help you with preparing. This actually reminds me of something that my mum does all the time, and she brings me liver, which is obviously high in a lot of nutrients, especially iron, because I had a lot of problem with bone marrow replacing itself because of all the chemo that I was having. I've had about 230 infusions up to this point, so I'm still going. But making things easier, batch cooking, using your freezer, definitely, and trying to be as efficient, I think, sometimes.
Saving that energy that you can use elsewhere and go out with your friends.
Or have a nap.
Not for long, Annice.
Not a long one. And have a nap so that you can go and have a nice little walk, which is obviously also something that can be helpful with that fatigue. I find that walking actually makes me feel, much more energetic. But anyway, back to nutrition, sorry, because I've deviated. But, having a regular meal pattern is something that is very, very important. I think Annice did talk about eating too late, or things like caffeine or herbal supplements, getting involved with those kind of things. And as a dietitian, we tried to just keep people away from all that misinformation that can be out there.
So do we.
Yeah, we just recommend a traditional kind of Mediterranean style diet. I think one thing that I do focus on a lot when I'm talking to patients about nutrition is the protein aspect, because I don't think people think about protein as a store of energy. They think of carbohydrates and starchy foods being a store of energy, but your protein, your muscle mass, is essentially, it's your stores. And if they deplete over time, you're going to become weaker and less able to tolerate the treatment, and you're definitely going to start feeling tireder then. So in respect of that, I always try to make sure that people are having protein regularly throughout the day, breakfast, lunch, and dinner. It's okay to have a cooked breakfast, or have, obviously with sustainability being a big thing at the moment, we're trying to talk about getting protein from
Black beans.
Plant protein. So
Love black beans.
yeah, black beans, kidney beans, tofu, soya, all those different types of things. I'm a big fan of kidney beans, actually. My friends will rip me to shreds about my kidney bean obsession. There's also, I'm going to move on to another thing, which is those vitamins, minerals, and the supplements. So vitamin D and B12 are two that we really, really talk about. Vitamin D being the sunshine nutrient. I do think that something that I would mention at this point is that if you take vitamin D quite late in the day, there is some evidence to suggest that it makes your body think it's
Awake.
Getting sunshine. And as a result, that can really affect sleep. That's definitely affected me.
Fascinating.
One thing, I talked about vitamin B12, which you can get from dairy products, meat, but also things like beans, pulses, and lentils as well. But I think one thing that has just come to my mind, which I would like to talk about, is the medications, because I don't think we talked about medications yet, in regards to things like dexamethasone. Now, this is something that has really had a big effect on me, where I've woken up at 4 o'clock every morning and had to use my phone because everyone else is still asleep, or go and watch TV at 4 or 5 in the morning, and I cannot get back to sleep because of dexamethasone. I even used Zopiclone, which is a sleep medication, didn't do a thing. So that's just another factor that I think should really be brought out as something that's difficult for people to manage. All those different medications that are mixing inside you. And yes, my pet peeve is dexamethasone. But anyway, sorry.
Well, no, steroids are notorious, aren't they, Annice, to cause people to become wired and awake.
Well, dexamethasone in particular, because it's super long acting and super strong. So, and that's part of most people who are on chemotherapy will be getting big doses of that at different times. And it's in many different cancer treatment regimens. So it's really difficult to sleep on dexamethasone. So yeah, I mean, that all of those things can impact on sleep. There's other medications as well. So it's just so different for everybody, because, you know, if you're on dexamethasone, you've no chance of getting sleep, but hopefully you won't be on that for very long. Hopefully most of the time it's short courses, but steroids are tough because they weaken your muscles and they make you feel, you know, your mood can go up and down and you don't sleep. So steroid treatment, which is part of many different cancer regimens, is very tough to get through.
Is it worth talking to your team about if it's really debilitating and seeing if there's something that can be done?
I did
Sorry, carry on.
I did my best to wean myself, because that's what you have to do with steroids. You can't just stop them immediately, otherwise you'll have very bad side effects sometimes. But it's that weaning down gradually, and I would always try to get it started as soon as possible. So it would always be a topic that I would bring up. When can I start reducing it down? Oh, no way, not now, Alistair. Next week maybe. And I think it's just working with the team.
Working with the team and advocating for yourself from what we're talking about here. Ruth, really quickly, in terms of your sleep, was your sleep disrupted?
Not really, to be honest.
You're a good sleeper.
Yeah, I sleep really well, which
Me
is
too.
nice.
I'm a good sleeper too. Well, that was easy. I'm going to come back to you because obviously you're 6 years post, and I want to talk to you about that journey in a minute. But Jo, the most really important point that I want to bring up is how important exercise is, or physical activity. So it's about moving your body. And as you know, Trexler is incredibly passionate about helping you move your body in a safe way during treatment and post-treatment and for many, many years to come. Sorry, just a little plug there, Jo.
No, absolutely.
Can you tell us about, actually every single person on the panel is passionate about exercise and the impact it has on people's lives. Annice and her walking, Ruth and her swimming, Alistair and his walking and his gym, and me and my hip, and you and your...
I do more or less everything.
There we go.
Keep it varied, keep it interesting.
So talk to me about if someone was starting radiotherapy in 2 weeks or weeks' time, would exercise have an impact on them and the impact that fatigue would have on them?
Yeah, absolutely. And again, for multiple reasons. Sometimes it's because they're out in nature walking, and the anxiety that they're experiencing because they're fearful of the unknown is alleviated because they're looking at the trees, or they're in the sunlight, or they're appreciating what's around them, or they're talking with friends and family while they're walking. You could also say as well that from a biological perspective, hypoxic cells, so cells that are depleted of oxygen, are not as radiosensitive. So that's why there's been a huge, big kind of media push around, oh, look, you've got chemotherapy patients who are now on bicycles and spin bikes. And it's real. You know, there is research to prove that the more oxygenated your cells are, the better. Now, I'm not suggesting that everyone needs to go in on treatment and do some exercise.
It's a good thing, though, right? If you can.
Yeah, absolutely. And if it's available, even if it's not, advocate for yourself and think, actually, it would really help me. But I think, you know, there's obviously that link around the biology of the treatments that you're accessing. But I also think as well, exactly like Alistair said, that nutrition, protein for repair. Our cells are undergoing such a huge amount of damage, normal healthy cells and our cancer cells. And, even from an inflammation perspective, making sure that you've got protein to help repair your normal cells is so important. So, when you are exercising and you're building muscle, you're going to have that store available. So it doesn't have to be exercise where you are running a marathon, because I do say this to patients when I talk about exercise. I say and physical activity, because I think if you've never exercised, actually starting going for a long walk or a run will impact on you, on fatigue, because you will be exhausted. Your body's not used to it. Plus you'll get really bad DOMS. So actually it's far better to think about, from a personalized perspective, as I keep saying, what is good for you. Get out more if you can, do into nature. If you prefer the gym, go to the gym. If you've never done anything before, then walking is a great place to start. There's a lot of there's some research recently around some of the swimming groups. I know you mentioned right at the start, Jemima, but there are some great swimming groups that have started up. Again, it's exercise, but it's peer support as well. So you're going swimming with people that are going through exactly the same things as you. And that is something that we all need when we're going through a cancer diagnosis and treatment pathway.
What you just said about, if you've never done exercise before and you're trying to smash out a 5K, there's going to be this, what do you call it? Boom and bust. What is it? And bust? Boom and bust. Boom and bust. And how do you keep an eye on your fatigue levels? Should you be having a diary? Should you be thinking about how you're feeling? Should people be having a fatigue diary? Is that a good idea?
Annice might have better insight to that.
Yeah, it can be really insightful, actually, because sometimes fatigue is often fluctuating. And sometimes life, you're doing all sorts of different things. And one day you might just feel utterly exhausted. And if you've kept a diary, you can look back at trends and different things that you might have done that may have triggered the fatigue. So keeping diaries is good. But going back to the exercise, I think the most important thing with exercise is make it sustainable. So what you were saying about the, couch to 5K or whatever it is that if you try and do something too quickly and it exhausts you, you're not going to persevere with it longer term. And, doing a one-off exercise and then not ever doing it again isn't really helpful. It's like a drop in the ocean. You need to be doing something that you're enjoying, that you want to keep doing. And that's the way you're going to get the results, the beneficial results, like walking, as you were describing, it's a stress reliever. It's like an everyday mindfulness approach. It's a cognitive activity in a way, but you don't have to do a 10-mile walk. You can go out for 5 minutes. I always say, move your body. If you've not been moving and you're exhausted, it's really difficult to get yourself motivated to do anything. So, don't aim high, aim low and make it sustainable. Baby steps is what I say. Microdose the exercise, and then it's more useful. But what Joe's saying about, the benefits in terms of getting oxygen into your cells, it's brilliant. It's great. Any movement is good for your cardiovascular system. It's good for, circulation, cellular activity, everything. So, and
your brain, isn't it? It's good for your cognitive as well.
I can't even start to tell you how good it is for absolutely everything. And when we're very sedentary, it sort of makes everything worse, but also your body kind of shuts down and goes into hibernation. It's harder to move when you're not moving. So build up slowly, but make it sustainable. And it's just good for absolutely everything, from blood pressure to diabetes risk, to risks of cancer coming back, to, everything, and to outcomes, everything, movement. And it doesn't have to be marathons. It doesn't have to be, HIIT. It can be, anything that's sustainable for you that you enjoy. And, you know, certainly for women's health, I always advocate it for menopause, really, really important as well. You know, strength for your bone health. You know, a lot of people, the treatments they have with chemo and other treatments can affect your bone density longer term. You know, we're all surviving cancer now. Cancer survival is better than it's ever been, and it's getting better all the time. So we have to think about our long-term health, and exercise is good for every aspect of long-term health too.
We didn't
So
pay her to say that either. Thank you for plugging Renew. So, Joe, in terms of the research around exercise and fatigue, I know our evaluation of our Renew program back in 2019 showed that there was an improvement in fatigue levels, both at baseline at the end of the course and then 6 weeks afterwards as well. What is the research out there? Because Professor Anna Campbell was saying that there's lots and lots of research to say that prehab and rehab really improves fatigue. Can you tell us why and some of the research out there?
Yeah, absolutely. So it's a massive area of interest at the moment, largely because we know that we're curing patients that previously we've never been able to cure before. They're going through tougher treatment sometimes, but actually the cure rates are increasing. And as a result of that, people are living with the consequences of treatment for a lot longer. And therefore, we're having to look at that and think about quality of life. So that's where prehabilitation has really come into its own. If we're able to prehabilitate, we know from extensive research now in all areas of cancer fields that essentially you're able to minimize the amount of time that patients spend in hospital. You're minimizing the amount that patients are needing to have consecutive appointments for follow-up care. You're also making sure that any comorbidities that patients may face later on in their cancer pathway are minimized. And by that I mean for younger patients, if we know that they have interventions for prehabilitation, we can have a positive impact on their lifestyle to prevent them from going on to develop cardiac issues, diabetes, high blood pressure. So actually the influence of prehabilitation and improving your overall health as a consequence of cancer can also ensure that you don't then go on to develop other things later on in life. Now, last year was a big year for research around exercise, and there's a big American conference called ASTRO and a big European conference called ESTRO, and two big research papers came out of there, which I'm sure, Jemima, for anyone who's listening, I can send you the details and link those in. But essentially they showed through primary research that exercise was positive from a prehabilitation and also rehabilitation perspective. I think rehab's been around for a lot longer. You know, we're used to seeing a physio on a ward and them talking about maybe some exercises after surgery. I think where rehabilitation is now coming into its own is it's considered along the cancer pathway. It isn't just surgical intervention that requires prehabilitation and rehabilitation. Any cancer patient going for any treatment will benefit from changing their overall health ahead of that treatment. So that could be for radiotherapy, it could be for hormone therapy, it could be for immunotherapy. So I think that's where the changes are happening, and as well where the research is coming out to prove that, which is kind of what we've always known, but there's evidence and data there now.
And in terms of the actual reason why exercise prehab improves fatigue, is there actual evidence to say that you've got a control for someone who hasn't done any exercise? There is a RCT trials.
Yeah, so there's two big projects at the moment. There's Active Together, and there's also the Great Manchester, I think it's called Cancer, I can't remember the name of it. I'll find out. But they've essentially published the data now that shows that prehabilitation and exercise interventions prior to having cancer treatment has had a positive impact on patients. There was some data that showed that it was less significant for some lung patients, but they analysed that and established that actually there were other variables at play that potentially could have influenced that. But yeah, the data is really positive.
And that's around everything from improving long-term health, but also fatigue levels, mental health, anxiety, depression, bone health. And this isn't just for people who are during treatment, post-treatment, it's also for people living with incurable yet treatable cancer. It's right across the cancer pathway. And as we've heard, the multifaceted things that impact fatigue are all the things that exercise helps with, from mental health all the way through to physical health and beyond. So we've talked about the fact that fatigue is something that cancer patients really struggle with. And you're 6 years post. Mm-hmm. Are you still struggling with fatigue, Ruth?
Yeah, I think it's one of the biggest side effects for me, and it always has been throughout the years post-treatment.
And has it got any better, or do you think you've just got better at managing it?
I think about 3 years post-treatment, I went to my consultant and I said, look, I'm still really tired. And she said, it's probably going to last for the rest of your life. She said, you're always going to, like if you imagine yourself as a battery, you're always going to be running about 70 or 80%. Whereas everyone else is going to be running 90 or 95%. And
did that help?
It did. Also, my consultant had cancer herself when she was 21, which was the age I was when I was diagnosed. And I could kind of see, she was telling me about how she then worked and became a doctor and everything, still managing her fatigue. And she says she still gets tired. So that kind of gave me a bit of hope. Okay, like I am going to be tired, but there are ways of managing it. And I think now I've learnt to manage it rather than try and push against it and be like, oh no, I don't want this fatigue, which I think...
So it's almost like being so angry that you kind of like don't do anything about it, you just kind of accept it, but you've actually found strategies. And can you talk us, I know we've been on for quite a long time, but what are the ways that you manage fatigue? We haven't talked about pacing, which I think is, can you talk us about how you'd apply that to your life?
So I think I just have to treat myself almost like you count as a disabled individual. And I think I only have this amount of energy in a day. How do I make my life as easy as possible? So that can be with making sure I get to sleep at a decent time. It's also about what I eat. It's about meal prep. It's me working part-time. It's making decisions based on the energy I have, and being quite upfront with my friends, especially because I think there's always that want to do the same things as your friends can do. And then I say, actually, could you come to me? Or actually, can we meet near mine or go for a walk or something, or go somewhere but have a little stop in between? So I think it's really about pacing myself, but I've also had to learn that over 6 years. I don't think it's come naturally at all.
It didn't. I met Ruth a while back, and it definitely didn't come naturally, did it? It was a kind of like you pushed yourself, and then realizing how far you'd push yourself, and having to kind of pick yourself back up again and try a different way. In terms of your friends having these conversations, what would you say to someone who's just finished treatment and they're like, I just want to go at life at 100 miles an hour?
I mean, I'd say go for it, because that's kind of how you learn, and do go for the things. I tried to run a marathon straight after finishing treatment, which wasn't the best idea I've ever had. But I think when my consultant was talking to me about fatigue, they actually found that your level didn't decrease, but that people kept pushing themselves up to the level of their fatigue, which I think is perfectly natural as a young person. I was very into exercise, and you do want to do all those things again. I just say, go for it, but you kind of learn where your limits are. And maybe one time you are going to say, actually, I do want to go to this party, or I do want to do this. So maybe the next day, I'll kind of just have to have it as a complete rest day.
And do you do that now? Or would it be you go to that party, then you go out for lunch with a friend, and then you do this, and then claps? But now would you pace yourself? So you're going for a massive party tomorrow night, Ruth?
No. I think I prioritize. So I think something that is really important to me, I'm going to do it. Or when I've been to a friend's wedding, and that is so important to me. But then the next morning when they're all having a massive get together and everything, I'm like, I can't do that. And I think I'm very used to now, I mean, my friends are very used to me at like whatever time at night, me being like, okay, I'm off now, guys. It was nice to see you. But I mean, my friends have been great. I think people do understand, but you have to be really explicit with people because they have no idea otherwise, because you look so healthy and you look so normal that actually they have no idea that inside you're like, I just need to sit down, or I just, you know, my brain is completely, you get to that stage in the evening or whatever where you can't even form words because you're so tired.
And that's a hard thing to say, isn't it? As a young person, be like, actually, I'm going to go home.
Yeah.
And saying what you need to. I mean, I was talking to someone earlier that the words "I need" are like a kind of like make you squirm, don't they?
Yeah.
So, have you learned to be able to say actually to your friends, I need you to come to me, or can we just can I cancel because I can't?
Definitely. And I think especially with employers, a lot of the time employers say, yes, we'll do everything to help you, but they don't know what you need because they don't have very much experience.
Yeah.
So actually, you need to think about what would be helpful, and then you say, I need this, this, and this. And I think that's very helpful for them because they can say, oh, okay, and they can make those adjustments. But you actually need to think, what do I need? Rather than just saying, I have fatigue. They don't actually know what that means. They don't know how that affects you.
And you don't know yet either when it
No.
comes to work. So is it about learning together and having those open conversations? Because it's never, you don't know one day to the next, do you? And was work good?
Yeah, they. I think they've done everything they can to support me, but I've kind of had to say, because no one where I work has, in the kind of management team, has had that kind of experience, and I started off my career after having had cancer, so I started off coming in part-time. I started off not really sure how it would affect me because I'd never been in the workplace before.
Yeah.
So it's kind of learning for me, but also learning for them, and having to be quite explicit and saying, I can't do that, or I need support this way, this way, this way.
And also, just to kind of plug our other lifting the lid on work, it's the fact that actually the Equality Act says that cancer is a disability and that you're covered for the whole of your life. And therefore, the concept that you've done 3 days and you can't cope and you want to go back to 2, your employer has to do that. And so it's about having those really difficult, I mean, as a cancer patient, you have difficult conversations with your friends, with your employer, with your family, and it's about really advocating for yourself, isn't it? I mean, we've heard that from you when it comes to your MDT, that you've managed to, it's all about shared care decision making. It's about saying, this is really important to me. With fatigue, this is really important, I want to go to this. It's having a conversation with yourself about what's important, but also just really knowing yourself through, isn't it, in terms of...
I've had to come to terms with taking naps. It was never something that I did previously. I never, ever didn't have all that energy, but now, I wake up and I look at the alarm clock and think, I've basically slept in, haven't I? How am I ever going to get back to work? I know that there is the whole reintroductory stages to going back to work, and thank goodness for them, because that's what I do worry about the most. But as I said, I have been very lucky to have had a mindset and an insight to what I would go through, and I've tried to counter all those things with the knowledge that I did have, and I've been lucky in most places to avoid, a lot of symptoms and side effects. But in regards to the fatigue, as I said, napping and almost the stress or the mental, fear of not being able to perform to a standard where what I was before. I was, and when I'm treating patients, that's quite a big kind of concern for me. It's mentally draining for me, and that's a side of the fatigue as well.
I think that sums up, I think, the fact that fatigue is, it's basically caused by so many different, the the bomb that cancer causes in your life causes so many different impacts, and that contributes to fatigue. I mean, we haven't talked about the importance of meeting other people and the impact that that can have on your mental health and improving it, which can help with your anxiety and problems with sleeping, because all of that anxiety can go through knowing you're not alone. Do you think that's an important point?
Sorry, I was just going to say, in relation to what you were saying, I think a lot of sometimes the symptoms that are side effects of the cancer treatment can exacerbate the fatigue. So when I started, because I've had pelvic radiation, I had very bad gastrointestinal symptoms, and the pain causes you, like, your fatigue to be worse. Your mental health can exacerbate that as well. But when you start helping yourself in other ways, or when I went and actually got that looked at, I think before I was like, oh, I just need to cope with it, then that helps the fatigue as well. So I think if you can address some of the underlying side effects, that helps as well. Because I mean, I've never had a problem sleeping, which has been very nice for me.
Very lucky.
But actually, when they were saying, well, what else can we do? I was thinking, well, I don't have a problem sleeping. How else can I help myself, really?
Yeah. And that's a really important point, is that all of those play into that feeling of fatigue. Thank you so, so much. Is there anything you guys want to add? Do you think we've covered the world and his wife when it comes to fatigue?
Can I just add that
Yes.
it's prehab for cancer? I had a brain fog moment, so that's the main research.
Prehab for cancer. We'll put it in the notes for the YouTube. Annice, is there anything you'd like to add?
Well, I think in terms of managing fatigue in the longer term, I was going to say lots, but I think Alistair and Ruth both covered it brilliantly.
Brilliant.
Covered pretty much everything that you covered everything. I think the only thing we didn't cover that I would have mentioned was, alcohol and smoking, because, I mean, I don't know whether any of this panel have smoked, but smoking is generally not helpful. And it's not necessarily, you might not say it's directly linked with fatigue, but it can be indirectly. And alcohol excess fragments your sleep and causes fatigue and causes all sorts of ill effects. They're not useful coping strategies, either of them. So that's the only thing. And everything else you covered really well, to do with managing the fatigue, pacing your activities, being realistic about what you want to do. I think the description of, going to the wedding and then not going to the gathering the next morning, that's such a useful, practical thing I tell a lot of my patients about, because if you've got a special event, do it. You'll be more tired after it, but if it's really special and it means a lot to you, do it. But just prepare for around that time. So I think you covered everything.
Alistair, is there anything you'd like to add?
Yeah, I guess the kind of thing that for me at the moment is just not a little bit of an opposite to you, actually, if I say so, that I'm having to really hold myself back and build myself up very, very slowly, because at the moment, I have a mentality that wants to overdo things, and actually, if I do them, I can't. A little bit like the marathon that you did, or was it?
Yeah.
So everyone is on a completely different journey, and I think that just has been exemplified in this chat, hasn't it? That everyone goes through a different experience, and fortunately on mine, fatigue, I've managed to get a handle of. So I just need to practice what I preach.
Brilliant.
And keep.
Ruth, I'm going to give you the last words. What would you say to yourself when you'd finished treatment?
I just say, I mean, I don't think I'd say do anything differently, but I'd say just be proactive about not only telling people, but also getting help when you need it. Because I think so long I sat on my gastrointestinal symptoms, I sat on everything because I just thought this is a side effect that I have to live with.
Yeah.
But you can, as soon as you tell specialists, and I mean, sometimes the waiting lists are very long, but they do start helping you, and you can alleviate those symptoms. I think be proactive with your friends, be proactive with work, just tell people about it, because you look so physically healthy that people don't expect it. But you can say, I need this, I need that, and you need to become your best advocate, which is easier said than done, but I think that's really important because you know your body best, and you still want to, you think of the rest of your life you've got to lead, and you want to be able to make the most of it on whatever way you can.
Love that. Wonderful way to end. Thank you, Joe. Thank you, Annice. Thank you, Alistair. Thank you, Ruth. And just to remind everyone, thank you so much for this and joining us this evening. Just to say that all of those things that impact your fatigue, we can help with through our Renew program, which is our 8-week online and in-person exercise program run by cancer exercise specialists. We also have opportunities for you to meet other people who understand what it's like to live with fatigue. So have a look at our website. We've got our What I Wish I'd Known Late Effects from radiotherapy and chemotherapy on the 24th of November. So addressing some of those gastrointestinal symptoms, looking at pain management, all of those things. So join us online for that. We've also got all of the different topics on our YouTube channel, which you can look at on our website to be able to, about work, lifting the lid on work, living well with cancer, sex and relationships, anxiety, mental health, you name it, we've got it. So have a look on our website because all of those contribute to fatigue. So thank you very much for joining us and good night.
Thank you.
Thanks, Jemima.